Now, releasing the hips is really important. We have already done videos which are about releasing the hip rotators. These are muscles that are deep into the hip, but often affect us through the back. This video is all about releasing the front of the hips. So the front of the hip area here can get really, really tight. And I'll show you what I mean by that is that we tend to get really flexed in this part of the hip here. And that's partly because of your growing bump, it brings you forward. Yeah, we tend to adopt these kind of postures, so we shorten over the hips. But basically, the hip flexors, these muscles are the hip flexors, tend to be tight anyway. They get tight just when you do a lot of sport, if you do a lot of running and walking, or any kind of sporting action, they can get really tight. They can get tight through sitting a lot. So if you sit at a desk all day, if you're having to sit down, if you're driving a lot, these muscles can get really shortened and tight. But they're also, particularly one muscle called the psoas muscle, is very emotionally connected to us as well. So this is a stress muscle. In the same way we get stress coming up into our shoulders, the psoas muscle is a stress muscle and it can get really, really stressed. Now, can't think of any other time where this muscle is more under emotional stress than during pregnancy. If you think of everything that's happening to us and all the changes that are going on in our bodies, it's no surprise really that this tends to get really, really tight and agitated. If you think of your muscles as something more than just a physical mechanical thing, they are connected to our senses, to our nervous system, and our nervous system is a lot about our sensory perception and our emotional sense. So muscles are affected in this way. So sometimes we have to learn to let them go a little bit. And a lot of the things we're going to do now are about letting these hip muscles go, and this is very much connected to birth, because when you give birth, you need to be open in this area here because you want your baby's head to come down. And if you are both physically and emotionally open in this position, it's going to really, really help you in birth. So we want to try and open that area. Now, I've got a block I'm going to put underneath my knee. You might want to use a towel or a cushion. I'm going to turn myself around and I'm going to put that underneath, actually I'm going to put that underneath that knee, and I'm going to bring this foot forward. Now, we want to open this area. So by coming into this position here, I'm lengthening and opening, but I can get length and openness in that hip just by squeezing my buttock. Yeah, so this is where your buttocks are really important to you. And I want you to go around every day squeezing your bum, because when you squeeze your buttocks, you open and put a little bit of length into this hip area here. And what you're doing by constantly doing that action, squeezing your buttock, opening the front of your hip, you're reminding your body of where you want it to be. Yeah, rather than being in this short and flex position, you're reminding it that you want the body to be open. So do that anytime, anywhere. Squeeze your butt cheeks. Gives you a nice pert bottom as well, so it's worth doing. When you are able to, I want you to go into this position and release and stretch. We do it in the classes, but do you know what? You can do it anytime. Hopefully you've already invested in one of these, and if you haven't, go and get one. They're great for birthing, and if you're in your earlier part of your pregnancy, you might be thinking, I don't need that yet, but you do, because it's a really useful tool to have. You want to have it at home, ideally in your living room, so that in the evenings you can sit on it, you can play with it, you can roll around on it, because it's a really good way to encourage you to adopt really good positions. And it's a really nice aid to doing this stretch. So I'm just going to hold it in my hand, but it just gives me a little bit of balance, and I'm just going to move forwards and backwards. And as I move forwards and backwards, I'll move that forwards actually and to put it there. As I move forwards and backwards, I'm just getting some lovely length and openness in this hip. And doing a rocking action is really good. Make sure your knee that you're balancing on, you're kneeling on, is okay as you're doing that. Obviously, you've got to make sure your knees feel comfortable. And this is just a really lovely way to open the hips. Now, I'm not trying to kind of push anything or force anything. I'm just reminding my hips of where I want them to be. Nice and open and long. And I can't tell you how important that is and how physically that will and emotionally that will help you if you just adopt this kind of action. You can also vary it by taking the foot out wider. So I'm going to bring my leg over this way, and I'm going to take my knee further out to the side. So I'm opening my hips a little bit more. So I don't know if you can see that. So now I'm opening with a slightly wider position. And again, later on in pregnancy, when you need to create more openness, that's another really useful thing to do. All of these positions must feel safe and good to your body. Obviously, you'll do it on the other side as well. If you experience any kind of pain or discomfort, you're going to stop doing that. And you're going to just go back to those buttock squeezes. And now I'm going to get another block, so you'd have another cushion between your knees. And all I'm going to do is I'm going to open and lengthen my hips by squeezing my bottom. So I'm just tucking underneath and getting that length into the front of my thigh, literally just by squeezing my buttocks. And I'm going to use my core control. So I'm going to take a breath, inhale, exhale, and lift up through my pelvic floor and into my belly and squeeze my bottom. And just by squeezing the buttocks, I'm really opening through the front. So don't panic if you can't do some of these movements. Listen to your body. If it feels painful, stop, don't do it. Do the alternative, which is this one here. There's another way we can stretch though, which is the last stretch I'm going to show you right now. And this is really nice as well. So I'm going to go back to being on one knee. And try this one, because if you feel pain doing the deeper ones we were doing, you may find you can do this. So you're not going to go quite so deep. You're going to hold yourself with your legs at 90-degree angles. And you're going to use your hands. You're going to pull your hands up over the front of your hip. So if you've got a big bump, that's fine. You're just going to put your hands underneath. Your arm will have to go around your bump. And you're going to lift the skin up over your hip. You're going to correspond that lift in your hands with a squeeze in your buttocks. Yep. And as you lift the skin up over your hip and you squeeze your buttocks, you're literally pulling the skin and a little bit of those tendons of those muscles up and giving yourself a really deep stretch. It's actually a really wonderful stretch. But here's the magic thing. When you breathe and you connect your core, the stretch gets even deeper. Just try it. So take a breath, inhale, exhale, squeeze your buttocks, lift the skin up and pull up through your pelvic floor and into your belly. And you'll feel that wonderful openness stretch coming across your hip. If you wanted to, you could combine that with a deeper stretch, but only do this if it's pain-free. So you pull up, lift up through your core, and then come forwards. But you've got to maintain that lift in your hands and that squeeze in your buttock as you do that. But that will give you an even deeper stretch. So I hope there's lots of different alternatives there that you can try. Remember to listen to your body, find the one that works for you, do not push into pain. Everything should be within your remit of comfort, but also feeling that extra length and that extra feeling of release in your body. We want to release the body. So use your breath, stay nice and calm, tell your body to let go. And it's amazing, I know that sounds weird, but it's amazing how much when you focus the mind and you actually tell the body to let go, you get this sigh in your body and you feel it open and you feel it relax. That again is another very important message to you about giving birth. We need to let go. I hope that helps.